Hello and welcome to this short presentation which looks at integrating knowledge and research paradigms into sports rehabilitation. So let's have a look and discuss what is knowledge. So in the context of sports rehabilitation, knowledge refers to the understanding and information that practitioners need through education, experiences and research. This knowledge is used to diagnose, treat and prevent injuries in athletes and individuals engaged in physical activity. So there are different types of knowledge in sports rehabilitation. So the first one is theoretical knowledge. And this is when we need to know principles and concepts related to anatomy, physiology, biomechanics and pathology. So understanding these principles help practitioners understand how the body should function and what might go wrong in case of injury. So an example of this is knowing the anatomy of the knee and the mechanics of movement to understand injuries like ACL ruptures or tears. The next one is practical knowledge. So this is hands-on practical skills required to assess, treat and rehabilitate injuries. It includes techniques for therapy, exercises and manual therapy. So an example of this is applying specific exercises and therapies to strengthen muscles and improve joint mobility. The next one is empirical knowledge. So this is derived from systematic observations and research studies. This includes evidence-based practices that have been validated through scientific research. So an example of this is using proven rehabilitation protocols for specific injuries based on clinical trials and studies. Tactic knowledge. So what this is unwritten. It's experience-based knowledge that practitioners gain over time through their practice. It is often intuitive and difficult to transfer through writing or verbal instructions. So an example of this is recognizing subtle signs of improvement or setbacks in a patient that are not easily measured. So what are research paradigms? So research paradigms are overarching philosophies or frameworks that guide how research is conducted, interpreted and understood. They reflect different ways of understanding the world and inform the methods and approaches used in scientific inquiry. So common research paradigms in sports rehabilitation. So we have positivism, and this is based on the idea that reality is objective and can be observed and measured. So research under this paradigm relies heavily on quantitative methods, such as experiments, surveys, and stats analysis. So give me an example within sports rehabilitation. So clinical trials testing the effectiveness of a new rehabilitation technique for sports injuries. Interpretivism. So what does this mean? It means it's a paradigm that kind of states that reality is subjective and constructed by individuals. It emphasizes understanding the meaning and experiences of individuals through qualitative methods, like interviews, case studies, and kind of thematic analysis. So for an example within sports rehabilitation, exploring athletes' personal experiences and perceptions of their rehabilitation process through interviews. Then we have critical theory. So this paradigm focuses on examining power structures, inequalities and social injustices. It aims to bring about change through critique and advocacy. So application in sports rehabilitation. So it's investigating disparities in access to rehabilitation services among different socio-economic groups of athletes. Pragmatism. So what does this mean? It's a paradigm which is practical and focuses on what works best in solving problems. It often involves a mixed method approach, combining both qualitative and quantitative methods. So examples in sports rehabilitation. So combining stats data on injury recovery rates with patients' interviews to develop comprehensive rehabilitation programs. And the last one is post-positivism. And what do we mean by this? So this acknowledges that while reality can be observed and measured, our understanding is imperfect and influenced by context. It uses both quantitative and qualitative methods. Giving an example within sports rehabilitation, so conducting controlled experiments while also considering patients' feedback and contextual factors as well. So in sports rehabilitation, knowledge is many different things, combining theoretical understanding, practical skills, empirical evidence, and kind of insights. Research paradigms guide how this knowledge is acquired and applied, influencing the methodologies used in studies and the interpretation of findings. By integrating different types of knowledge and research paradigms, sports rehabilitation practitioners can develop more effective and holistic approaches to injury prevention and recovery.